Hello my beautiful friends, this is Miriam. I am going to make you another video about how to finish first semester of nursing school. Before I start, I have two things to tell you. Number one, congratulations for getting accepted to the nursing school. All of your hard work have paid off. And number two, thank you for choosing nursing. You're going to make so many people happy, and I believe this is one of the best decisions that you made in your life, if it's not the one. Okay, let's start. First semester of the nursing school is not hard. It's just simply stressful, okay? So my advice to you is to just be calm and don't be stressed out. And I am going to share my tips with you guys, and I hope my tips going to help you to decrease your anxiety level, okay? Well, since I believe the reason of being stressed out is because of the lack of knowledge or because you don't know what to expect, so I am going to tell you what to expect, and then hopefully you will not surprise, okay? First semester of the nursing school, you have three classes. You have the skills, you have theory class, and you have clinical class. In the skill class, you are basically learning how to do the stuff that the nurse is going to do, like injections, like inserting IVs, like inserting, NG tubes and stuff like that. How to be successful in that course, I would tell you, you need three things in order to be really successful in that class. Number one is having really nice and outgoing personality, because you need a person to practice with. So you have to have a friends or buddy, and as much as friends you have, as much as practice you can do, okay? And that person should have instruction, because in order to inject, like for example sub-Q injection, you have instruction which has 40 steps, right? Then that person should have that 40 steps and should quiz you. You should demonstrate what you're going to do, and that person should tell you you're doing it right or you're doing it wrong. So be friendly and have lots of friends. Tip number one. Tip number two is to record your instructor when she's doing it, okay? The way that she's doing is most likely the way that she likes you to do it. So record her when she's doing it and then listen to it, okay? Number three would be one of the most important rules during nursing school, okay? So it's not specifically about skills, but it's actually really helping you if you just follow that rule. And that is to be really respectful to your instructor, okay? Be nice and respectful to your instructor. They have too much power, and they believe in personality. So if you have a positive and nice personality, and they like you, you most likely would be successful. So to decrease your stress, I'm going to tell you we had 100-something people in our classroom, and only one person failed and kicked out of the nursing program. And that person had too much attitude, okay? So she was not a positive person at all. Try to not correct your instructor, and always try to learn something, okay? Your job is to learning something, not to correcting people. So do your job. Okay, then you have a theory class. For theory class, I have a previous video how to study or how to pass the whole nursing school, and I shared all of my tips with you guys in that video. But to recap, read all of the boxes, all of the titles in the foundation book, and then you need David's Success Series book. Actually, I bought it and I really got a benefit from it, so I'm going to recommend it to you guys. So that book has so many NCLEX questions which prepared you for taking the test. So take David Success Series. You can find it online everywhere, and then read all the boxes and PowerPoints, of course, and record your instructor voice and listening to it, okay? So that's about theory. Then the last one is clinical, which is fun, okay? You never had this kind of class before. It's just like a skills. You get the opportunity to feel like a nurse, right? So for going to clinical, you have to pass dosage calculation test. That's whole different another video, okay? But basically, it's not a hard test. It's actually a mathematical operation that you have to calculate the dosage of the medicine according to the person's body's weight, okay? So it's not hard. Some of those could be tricky, but I'm sure with the practice you will do great. So watch some videos online about it, or if you want me to make one, you can ask always in the comments. So let's say you pass dosage calculation test. Now you're in the clinical. In the clinical, there is one rule that you have to keep it in your mind, and one most important rule, and that is that you are not a nurse, okay? You're just a tech. That's how you should be, okay? So you cannot do anything that those nurses are doing. All you can do is to be a friendly, nice tech, or nurse aide, okay? So basically, you can clean and you can try to not make things complicated. You have to do so many care plans and journals and stuff like that, and they will ask you, okay, what is your nursing diagnosis for this patient, okay? So you have to come up with 3 nursing diagnoses usually that you can do something for them, okay? You know, you cannot, at this point, you cannot do too much. You just can do very limited stuff because your knowledge is limited. So I have 3 favorite nursing diagnoses for the beginners, which I love them and I got so much benefit of them, and I'm going to share it with you, okay? So I always I put risk for fall as one of the diagnoses, okay? Because in my mind, in my view, those people that they're in the hospital, most likely they are old, they are at the bed rest, which decrease their motility, muscle strength, and they're getting narcotics, which makes them dizzy. So they're at risk for fall. What you can do for it, you can always make sure that the bed is in the lowest position, side rail or up, the patient's cold right is in reach, and you teach the patient to, anytime that they want to come out of the bed, use that cold light, and you have to put a sign outside of the door and basically tell everyone, hey, this patient is at the risk for fall, okay? And there is other stuff that you can do. You can Google and you can find them easily, okay? So risk for fall, always a good one. Second thing would be risk for constipation. I know that's gross, but have you ever been constipated? You know how painful it is. You know how hard it is. So don't forget that, okay? For constipation, those people are at the bed. Why they are constipated? Well, they're at the bed, they're not moving. So when you're not moving, your GI tract is not moving as well. So the peristalsis is going to decrease, right? And then you're getting narcotics, which slow down everything. So you're at risk for constipation. What you can do is you can offer them 8 glasses of water per shift if they are not on the restricted fluid. Usually, if they don't have a heart condition or kidney condition, they are fine, okay? So 8 glasses of water, 8 glasses of water per shift would be great. One, you can ask to ambulate them if they are able to, and you can teach them about fiber. Okay, you can basically don't tell them increase your fiber because they don't know what is fiber. You have to tell them, hey, how about having oatmeal for your breakfast, or how about having a salad for lunch, you know? So the stuff that you know they have a higher fiber, they offer them to them and explain the reason for it, okay? And the last nursing diagnosis, which I really like and makes me very frustrated if people don't follow that, and this is one of the simplest and easy way to stop any complication, would be bed sores, okay? They are at risk for bed sores. They are laying on the bed 24 hours, 7 a week, okay? So they are really prone to a skin breakdown. So what you can do is you can always turn them every 2 hours. Of course, ask a nurse for help, and if there is not any contraindication or stuff like that, okay? So turn them. Assess the skin every single time that you went to the room. Okay, go ahead and look at the bony area, you know, and make sure it's not red, you know, if it's red for 5 minutes, it's okay. But if the redness doesn't go after 5 minutes, then you should do something. You better do, okay? So that was my 3 favorite nursing diagnoses for foundation students or for beginners. And my general tip about the whole semester is to try to find a good person and go through all of those hardships with that person. It's always easier to experience things with someone, to share your thoughts and feelings with someone. If you trying to help people, everyone trying to help you, okay? So be helpful and you will get so much help, okay? So those were my tips. I hope you guys like those tips, and please share your thoughts and feelings with me. And I wish you the best luck, and I'm sure you will be successful. Bye-bye.